A COVID summer surge is underway here in the U.S. with new cases spiking all over the country.
And healthcare providers are working with the CDC to make sure this new surge does not turn into another full-blown epidemic. Anthony's here now with the latest. And so many people you talk to in the community, every time someone's got a sniffle, they're like, you better test, you know?
I got over it myself like 3 weeks ago, so no joke here. The CDC reports at least 7 states are experiencing what it calls very high COVID levels. Illinois is thankfully not on that list, but health officials say it's important to stay vigilant. In the past week, the testing positivity rate is up 11% from this time last year. COVID-related ER visits have risen 1.3%. It's being largely driven by a COVID variant known as the flirt variant, which is now responsible for more than half of all new cases. This is highly transmissible. The good news is that symptoms appear to be less severe.
Some of the same symptoms that, previous versions or mutations of COVID have had, with nasal congestion, sore throat, fever, not as much cough, which kind of throws people off.
Doctors and public health officials are also quick to point out this surge is extremely mild compared to those we've seen before. And while hospitalizations are up slightly, the majority of the patients are either elderly or are dealing with other underlying medical condition. The CDC is now organizing a new push to get folks up to date on their vaccines. They are also recommending that if you feel sick, test daily for 5 days, and in the meantime, wear a mask. Brian.